Alzheimer's disease is common, and the number of people living with the disease are increasing.
Every 65 seconds, someone in the United States develops Alzheimer's disease.
Alzheimer's disease is the sixth leading cause of death in the United States.
Data from the U.S. Department of Veterans Affairs estimates that more than 750,000 older veterans have Alzheimer's disease and other dementias.
Alzheimer's disease risk factors are directly tied to military experience, including post-traumatic stress, depression, traumatic brain injury, successive concussion syndrome, and blast-induced neurotrauma. The number of veterans being treated for these conditions by the Veterans Health Administration increased by 166% from 2002 to 2014.
Veterans serving in Operation Enduring Freedom and Operation Iraqi Freedom are experiencing nearly double the rate of combat-associated head injuries.
People of racial and ethnic minorities, such as blacks and Hispanics, are more likely to develop dementia for reasons that are not entirely clear.
Although there are more non-Hispanic white individuals living with Alzheimer's disease and other dementias than any other racial or ethnic group in the United States, older Black and Hispanic individuals are more likely, on a per capita basis, than older white individuals to have Alzheimer's or other dementias.
There's evidence that misdiagnosis of Alzheimer's and other dementias are more common among older Black and Hispanic individuals than among older white individuals. Health conditions, such as cardiovascular risk, also contribute to a higher risk of dementia among Black and Hispanic individuals. Some of those factors include smoking, obesity, and diabetes. In fact, lower levels of education, higher rates of poverty, and greater exposure to discrimination may also cause increased risk in Black and Hispanic communities.
The risk for Alzheimer's disease is greater for veterans from minority populations, and it is predicted to increase from 23.2% of the total veteran population in 2017 to 32.8% in 2037.
The lack of minority participants in dementia research studies limits our ability to help and support all communities.
A person can have Alzheimer's disease for years before being diagnosed.
Alzheimer's disease is thought to begin 20 years or more before the symptoms arise, with small changes in the brain that are unnoticeable to the affected person. It is important to understand that a significant loss of memory and mental ability is not a normal part of aging.
As the population of the United States ages, Alzheimer's is becoming a more common cause of death.
The long duration of illness before death contributes significantly to the public health impact of Alzheimer's disease because much of that time is spent in a state of disability and dependence.
The most common early symptom is the inability to process newly acquired information. Severe dementia frequently causes complications such as immobility, swallowing disorders, and malnutrition that significantly increase the risk of serious acute conditions that can cause death. Older veterans suffering with traumatic brain injury are 60% more likely to develop dementia, and dementia onset occurs on average 2 years earlier than veterans without traumatic brain injury.
When you start experiencing symptoms, get a medical exam early.
Primary care providers may be in the best position to spot the earliest signs of cognitive decline.
People with Alzheimer's or other dementias have twice as many hospital stays per year as other older people.
Total per-person health care and long-term care payments for Medicare beneficiaries with Alzheimer's or other dementias were over 3 times greater than payments for other Medicare beneficiaries in the same age group.
Only about 1/3 of seniors are aware that Medicare will pay for testing and care planning for people who have Alzheimer's disease.
The burden of Alzheimer's disease is severe and life-changing.
As symptoms worsen, the care required of family members can result in increased emotional stress and depression, new or exacerbated health problems, and depleted income and finances due to disruptions in employment and paying for health care or other services for themselves and people living with dementia.
82% of seniors say it's important to have their thinking or memory checked, but only 16% say they receive regular cognitive assessments.
Older adults would benefit from the increased awareness of the importance of brief cognitive assessments and of follow-up testing when cognitive impairment is detected.
There is currently no cure for Alzheimer's disease, so we need more people in research studies to better understand what causes it and how we might treat it.
People like you.
People like you.
People like you.